So, good evening, everyone. My name is Dr. Darko. Today, we're going to be talking about careers in healthcare. We're really excited to be talking with you all. As you all know, we're part of Tour for Diversity, and we're super excited to be a part of Health Professions Week. And we're going to talk about, in some form or fashion, in various ways, each one of us kind of lives our life in a very different way. And I think it's really important. We all think it's really important to share our career and share even some of our work-life balance, how we handle these things, and how maybe you guys can get nuggets of this and kind of direct your life and your career in a similar fashion. So before we jump in, though, let me just say that the Tour for Diversity in Medicine, it's a grassroots effort that's here to educate, inspire, as well as advise minority health professionals with terminal degrees. We visited 27 states, typically HBCUs, Hispanic serving institutions, and community colleges. And we focus on providing groups of unexposed students a chance to learn from and meet with visiting physicians, dentists, pharmacists, medical students, all at their home institutions and without any financial burden. Having expanded significantly through virtual platforms, Tour for Diversity provides initial and honest exposure to careers in the medical field, as well as opportunities for their educational and professional advancement. We are excited to join the Health Professions Week every year to share our diverse perspective and experiences. I got the blurb over with. Let's get this going. I'm excited to be joined by some amazing doctors on here. Let's start with the doctor that's on actually this way. That's Dr. Elizabeth Nunez. Do you want to take a quick moment to introduce yourself? Tell us who you is.
I am happy to. So I'm Liz Nunez. I am a dentist with a degree also in teaching. I work for the Veterans Health Administration. I'm the National Director of Education for the VA. Office of Dentistry. I wear a different hat. I'm the National Director of the Homeless Veteran Dental Program. I was a military dentist and for a few years and then came into the VA. So I've had a long federal career and I live in Tampa.
Yeah, Florida. Okay, let's go for the guy who looks like he's in a Tesla. Is that Dr. Nathan?
That's me. I'm Dr. Nathan Lott. I'm a practicing pulmonary critical care doctor currently in Waco, Texas, where I've been here for the last 3 years, trained in Ohio and back in the home state. Loving what I do.
Before we move on, though, let's remember that we got folks here who may be pre-meds and maybe a little bit further ahead. Tell us, what is a pulmonary critical care doc real quick? What does that mean?
So pulmonary stands for pulm, i.e. lungs. So I manage patients that have COPD, so the people that smoke for their entire lives or for a short length of time but have a predilection for damage to their lungs from it. Patients that have asthma. I do a lot of work on diagnosing patients with lung cancer and or some other cancers that do metastasize to the chest. And then I also deal with other I'd say less prominent diseases like LAM, which is more than I think we need to get into for what we're talking about. And critical care, I work in the ICU. I deal with the sickest of the sick, and sometimes they do well and sometimes they
So
don't.
people who are on the ventilators, like those type of things, where they see like people with a whole bunch of IVs and medications on them, those are the people you take care of.
That's what I do.
Okay. All right. Thank you for clarifying that. And then diagonal here, I have Dr. Brandon Henry, B-Hen. How are you? Tell us what you do, man. Introduce yourself.
Man, I'm good. Hey, everybody. I am Dr. Brandon Henry. I do what's called primary care sports medicine. So my life is not as severe or as serious as Dr. Nathan Lott's. I don't deal with the life or death, but I deal with nothing but athletes. So I'm the chief athletics medical officer at California Baptist University, physician, and I'm also one of the team physicians for USA Men's Water Polo. I'm in Riverside, California.
That's a sport?
Water polo, let me tell you, I used to think the same thing until I got with our Olympic team and saw the other countries and saw that's a real sport. it's real, but it's a great life. So, but yeah. Oh yes. Sorry, my coffee's here.
Nope. You always got to get time for coffee. So
Always.
what does that mean when you are a team doctor? Tell us what that means specifically. Like besides you're traveling to the Olympics and all that, what does that mean?
Yeah. So really, when it comes to being a team physician, I am responsible for the care of and the care in totality of our athletes, whether it's the primary care side or whether it's the sports medicine or the musculoskeletal side. So as a team doc, if a kid has a sore throat, runny nose, maybe whatever it is, right? I take care of them. If they have an ACL tear on the other end, right? I diagnose the ACL tear. I make sure we get the imaging that's needed, and then I send them on their way to the surgeon if surgery is something that has to happen. So really it is taking care of the entire the athlete in their whole, and I make sure that they get to the places that they need for either their primary care. Again, if they need elevated care, physical therapy, whatever it may be.
Okay. Thank you for clarifying that. And last but not least is myself. Hi, everyone. My name is Dr. Nee, as I introduced earlier, but I didn't say what my specialty is. I am a trauma critical care surgeon. So very similar with Dr. Nathan. He takes care of the sickest of the sick patients. But with me, I also operate on the sickest of the sick patients. So if you can imagine anybody who's in a car accident, who got shot, anybody who got stabbed, anybody who needs their appendix taken out, those are the type of patients that I take care of. Anybody who needs an operation in 24 hours. And I really am proud of being able to take care of people from the ED to the OR to the ICU and hopefully to rehab. So that's the type of stuff that I do. I'm the surgeon that nobody ever wants to see, but I still love it. So
Facts.
in that same vein, then let's start with Dr. Dr. Nunez. Let's talk about what makes you most proud to have chosen your field, because you've listed all of these amazing areas where you've worked, as well as being able to serve the underserved. I think working with the homeless population with dentistry. Tell us what makes you most proud of why you chose your field of dentistry.
I didn't expect to go down the path of serving soldiers, but I did. So I entered the Army and prepared soldiers to go fight for us. I was in the Army right on the eve of invasion of Iraq. So a lot of soldiers coming in, they needed to get dentally ready so that they would be prepared to do what they needed to do to serve the
Is this the first time in Iraq or the second time, like in the 2000s?
in the 2003.
Okay. Okay.
And then for me, it was a perfect transition as I was transitioning out of the Army to go into the VA and serve veterans. And I'm a veteran, so it was kind of very personal to me, and it just made sense. So I'm very proud to take care of people who have borne the battle, who have served their country. And on the eve of Veterans Day, this couldn't be a better presentation for me to talk about dentistry and to talk about the VA and how we take care of our veterans in a very holistic way. We have a big push in the last few years to approach care in a whole health way, to not ask, what's the matter with you, but what matters to you. And oral health is a big part of that. And we also kind of treat the sickest of the sick in the sense that in VA dentistry, those veterans are primarily 100% service-connected disabled veterans that we see. So a lot of pathology, a lot of things that maybe a general dentist in the private sector wouldn't see. So that's what
I'm
makes
glad you
me
clarified
proud.
that.
Yeah.
So what is the VAs for those who don't know? Tell us what that is.
So the Department of Veterans Affairs is a governmental agency that has three arms. One is healthcare, that's where I work. One is benefits, to provide benefits of whether they're educational or home loans or whatever for veterans. And then the other arm is cemetery, which is end of life care. all the national cemeteries are covered by VA. So that's what VA is, short for Department of Veterans Affairs.
Now, do you do any like reconstructive type of dentistry, or tell us the scope of your dentistry practice?
Sure. So a lot of what I do is administrative. But when I'm in clinic, or when I have been in clinic, and what clinicians in the VA do is every kind of specialty except for pediatrics that we have. So they do from fillings, cleanings, extractions, implant care, full mouth reconstructions, kind of whatever that veteran might need.
Awesome, awesome. Now, to the gentleman who just went to the back of their Tesla with the X-wing, we saw the simple flex.
Yeah, you seen that?
We saw the flex. He thinks we didn't see that. As host, I have to pay attention.
Right.
Dr. Lott, as a pulmonary critical care doctor, and especially coming off of COVID, I know you got a ton of stories. You know, plenty of people were in the ICU, and you see a lot of people live, and you saw a lot of people die. But what is it that makes you most proud of the field that you chose?
I love what I do. I love the action. I love the fact that it's very physiology based. And from an internal
What does that
medicine
mean?
background.
What does that mean? Tell us what for the folks who don't understand what physiology, like I know they know what physiology, but what does that mean? Physiology means, what do they
So
mean by that?
it's knowing how the body acts, how the body is supposed to act, how medicines affect the way the body acts, how what I do can improve how your kidneys function, or how I can impact the function of digestion and things like that. It's knowing what the body's supposed to do and then trying to help coax it back into that set of homeostasis, so to speak. And a lot of critical care is literally internal medicine just on steroids, is the best description that I have. It's being able to take a person where they are and then trying to get them back to normal. I love doing procedures. You know, I do central lines, I put breathing tubes, so I intubate patients all the time. I help my nurses put NG tubes in because sometimes they're a little rough, a little difficult. So I help them do those. Putting chest tubes in, open, closed. There's a lot of things that I can do, and I love the fact that I have the versatility to address so many different organ systems with what I do. The age-old description of internal/eternal medicine is the question. You know, we always search what's the question? Why is this person doing X, Y, Z? And being able to come up with an answer and formulating a plan to help this person come back to being normal. That's what I love about what I do.
Okay, I appreciate that answer. Dr. Henry, why don't you tell us what makes you most proud of why you chose your field?
Just last night, so we're hosting the conference, the WAC conference. We're hosting the men's soccer tournament, and was having a conversation with my the athletic director, and he and I both played Division I football, and then we have two other brothers that are on staff with us that also played Division I football, and they were talking about doing like this some sort of like story about how that as to go in line with the NCAA's thing about how majority of student athletes go in other fields other than their sport, right? And so one thing that I love is the fact that as a Black physician that is a sports medicine doctor, I'm around all these athletes and a lot of student athletes of color, right? And as they have been coming up, all they have really been known or been told is that they are great athletes, right? And they're so focused on, as they say, getting the bag, which to them means a professional contract, right? But the position that I'm in, I action with them that says, hey, listen, you know, I come from where you come from. I too was a student athlete in college, but you know, I am now a professional. My professional sport just happens to be medicine. You know what I mean? And I have a different kind of bag. It may not be the professional athlete bag, right? But I have the
It's not
professional,
NLI bag.
right? You know what I'm saying? But I get to have these conversations with them, right? And we always say on a part of the tour when we go and talk to students, we always tell people to be what you can't see, right? And so now a lot of these student athletes of color get to see a physician of color that comes from similar backgrounds, that played collegiate sports, but was able to do something outside of that marries. You're still in the sport, right? But now I get to be the physician of it. So it's been a ton of fun, again, just to be able to have those real conversations. And I'll say that, you know, as you see, I have all these different, you know, tattoos and everything. And one thing about being a sports medicine and having all this is that my ability to be able to connect with all of my athletes, and in that connection with them, we can have real life conversation. And it's done a great service around here, and I absolutely love being able to do that for them.
Okay, love it. Dr. Nunez, what's your typical day look like?
I work a lot behind a desk. I never thought I would. Again, it's interesting how dentistry and medicine and all these different professions use. Oh, I keep getting my video keeps cutting out. Sorry about that.
Trying to hate on your shine, that's all it is.
I don't know. Come on. Okay. So where I started, you know, very in the operatory, procedures all day long, I started moving a little bit more towards administration and found a really nice balance where I could still see patients, but then I could run this homeless veteran dental program. I could run the education program. So it's a nice mix. I've leaned more towards the administration now than chairside dentistry. So my day is involved in building curriculum for staff members around educational things that are of interest to them. We started with a lot of clinical dental education, but now moving into a lot of interprofessional work, diabetes, COVID, all these different areas that touch dentistry. So that's what I've been working on primarily over the last couple of years.
Okay, all right, thank you. Dr. Nathan, what are we talking about with your day? What's your typical day like? What time are you waking up in the morning and getting out?
It depends. Depends on what my rotation is. So I do both inpatient and outpatient pulmonary. So when I'm in the hospital, my day generally starts around 6:30 to 7. And that's because I have a family and I like to get up, get the kids ready, all that other good stuff, drop them off at school. I'm usually at the hospital between 7:30 and 7:45 when I'm rounding in the ICU. I go in, you know, I get my coffee, have a little bite for breakfast. I call and or speak with my colleague that was on call the night before if I'm not the on-call doctor. If I am the on-call doctor, I'll talk to one of my colleagues, you know, give them sign out on any of the patients that I may have heard about overnight. And then I do my rounding, and rounding lasts until rounding is done, whenever that may be. Sometimes it's 10, sometimes it's 12, sometimes it's 12 the next day. You know, it all depends on just how busy it is. Now, post-COVID, you know, rounding is a lot less intense because I don't have that same, you know, 20 beds of, you know, in critically ill COVID patients and ARDS and septic shock and in need of lines and chest tubes and everything else. So, you know, thank God I don't have that as much as we did, because those days were long. But that is the day. I also, even when I am in the ICU, split some time and see some patients that are in my office. So I may come out and see a patient that needs to be seen in clinic. And I usually only will see for like an hour, maybe 2 hours in the clinic when that happens. When I have a clinic day, clinic starts at 8, ends at 5, and it goes until I'm done.
Till 5, yeah.
Usually we'll see patients, new patients I see for 40 minutes, and my follow-up patients are scheduled for 20-minute follow-ups. And I get through somewhere between 18 to 21 patients a day when I'm in clinic.
Wow,
And
that's a lot. That's a lot.
Is roughly one every 4 to 5 weeks where I'm the on-call doctor. So we have a pretty good schedule here.
How long is your call schedule? Like when you're on call?
24/7. So I'm on for a week.
So you're on for a week. You're the person who's making decisions, rounding on patients, doing procedures 24/7.
Mm-hmm. In
Wow.
the ICU, I'm available. And I'm in when I round. In the evenings when I finish rounding, I go home and I'm available for calls. So if the hospitalist that's on overnight has concerns or questions, or they feel like, they need, assistance, or the ER doc calls like, hey, I've got this sick patient coming in, I'll be the one that they call and talk to give them some direction if necessary to help stabilize the patient. And then I make the decision on whether I need to come in to see the patient, or if all they need is, some guidelines on what to do, and then I can come in the next morning if necessary.
Okay. All right, Dr. Brandon, let's hear about your typical day. What are we talking about?
So yesterday was actually a great example of a typical day. So yesterday I had clinic. So clinic for me usually starts about 8:30. So I'm not I don't like to get to the office any earlier if I don't have to.
I'm the same way, actually. I don't like getting there early. Yeah.
Man. But yeah, yesterday I had a clinic from about 8:30 to 12:30. And then again, because of my role as the chief athletics medical officer here, because we're covering the RAC tournament, now I have to put on my other hat, which is all of the games that are happening for the tournament. So I had a game at 4 o'clock that I had to cover between two teams for the first round, and then my school played at 7 o'clock, so I had to cover that game. So yesterday was a great day of patient care as well as game coverage, and those are kind of my most fun days when I get to do both things inside the same day. But if I don't have a game that I have to cover in the evening, then it's typically just clinic from 8:30 to 5. And then sometimes there's games that I have to cover in the evening time. They may start at 7, whether it's basketball, since basketball season is now into play. We're in Nia, just, I'm me and Dr. Darko and Dr. Lott, we tend to talk sports a fair amount, and I'm an LA guy through and through, and
One out of 3 of us knows what we're talking about, though.
yeah, I'm suffering at this point.
Sorry about your Lakers.
Slowly suffering. So anyways, but yeah, coverage, and you can kind of see my calendar, and those are games like on Friday tomorrow. I have a game at 1 o'clock I have to cover, a game at 4 o'clock, and the game at 7 o'clock. On Saturday I have a game at 3, and then on Sunday I have a game at 1. It keeps me busy, but it's a lot of fun because really I'm just watching games unless anything happens in the game. Last week we had a girl whose shoulder dislocated, and she came off to the sideline, so it was my responsibility to reduce the shoulder, and it's always a lot of fun when that happens. So
does it just make a pop noise when you pop it back in?
it really does. Like she was nice and flat here, and so you kind of pull down traction on the arm and do kind of an external rotation, and then all of a sudden you hear this, and all of a sudden she goes, "Oh, thank you, I can." It's like, all right, good, done deal. Okay, I'll see you later.
Can she go back in the game or no?
I told her athletic trainer, I said, for me, if she's got full strength, full range of motion, she can go back in. I don't, she's a chronic subluxer, which means she does it fairly often. So if you want to go back in, that's your choice, not mine, right? So that's when I have to kind of say, this is what she needs to have to play. You as athletic trainer and the coaches, you guys can make that decision. But so real quick, Neat. So Dr. Darko, what is your day like?
Yeah, so
You being a trauma surgeon, yeah, let's hear about it.
yeah, so my day starts at 7 o'clock in the morning. So I work 2 weeks out of the year. And the way how I do that is I push everything into these 2 weeks so that the other 2 weeks I don't have any responsibility whatsoever, which is a new way of looking at surgery.
That's awesome.
Yeah,
We knew you meant to say 2 weeks out of the month, not 2 weeks out of the year.
did I say out of the year?
Yeah.
My bad.
I want your job.
Sorry, guys. 2 weeks. So there's some people like, oh, word, I want to do that.
Wow.
No, it's not like that. Sorry. 2 weeks out of the month. My bad, guys. And what I do is I work, and it's kind of like a work hard, play hard type of experience where for 2 weeks, I am pushing it really hard. I start my days depending on if I'm on day shift or I'm on night shift. Either way, when I'm on and I'm in the hospital, I'm handling all of the emergencies that occur for 12 hours. So if I'm on during the day, like I was today, 7 o'clock, I get in and I get sign out from the person who was on night shift, who worked from 7 p.m. to 7 a.m. and basically tag, you're it. He lets me or she lets me know everything that's happened overnight. They give me a list and they let me know if someone needs an operation or not. And then during that time, I'm just rounding on patients in the intensive care unit or in the ED or anywhere in the hospital. I'm rounding on patients and I'm available to the ED. I'm available to anybody who gets into a car accident. So if EMS brings people in, or if other hospitals have patients who are really sick and they're a little too sick for their hospital, they'll give me a call. So I'm kind of taking everything all at the same time. And it really is a life of eat when you can and sleep when you can. And I'm there and I'm operating and I work until 7 p.m. And I actually had someone check me out a little bit earlier today so I could be here for this event. But usually 7 p.m. I'm out. And then from 7 p.m. to the next morning, I'm in a hotel room or I'm at my house and I'm just, relaxing and waiting. And I do that, rinse, wash, and repeat for a week at a time. Once I'm done, then I'm completely off. I'm off. I'm with my family. I'm, with my wife and with my kids. I have some other interests that I'll talk about later. And then I do that again. And then maybe the next week that I do that on nights. And that's when it's 7 p.m. to 7 a.m. and it's the same exact thing. And I really enjoy it. It's something that has taken me a long time to be very open and honest, to say, hey guys, like I really just like to work like this. I'm not the prototypical general surgeon that, wants to have his own clinic. I just kind of want to take care of people who are about to die and then I'm out and kind of tag somebody else as it. And there's a space for it and it fits for me and I like it.
Right.
So so it's just kind of that's how it is in medicine, folks. So with that being said, I want to turn around on you guys. What is the thing that you got wrong about your field? Dr. Liz, what is it that you think you're like, I did this right, but looking back, maybe I got wrong about this and I miscalculated this about the field of dentistry?
Gosh, I have to say, I think I chose the right profession because it's a beautiful profession where you get to have instant gratification lots of times. So someone can come in with pain, infection, maybe their teeth don't look right for whatever reason. And after that hour or 2 hours with me, hopefully they're coming out pain-free, nice smile. So that piece I didn't know that I would enjoy as much. So that part I got right. I don't think there's anything I really got wrong, to be honest, except I'll say, when I came in, dental schools were very heavily male. And fortunately, now we're starting to see finally that there are just as many females as males entering dental school and starting to graduate. I'm a first generation American. My mom is Ecuadorian. My dad is Cuban. And so I'm starting to see that change too, a little bit, more Hispanics. We're really trying to get equity everywhere across all ethnicities and races and stuff. So we're getting there. So I'm happy about that. I feel like even in the military, I would always be the only female officer in the room. Certainly, oftentimes the only Latina in the room. You know, so as I see those things changing, I'm happy. So what I thought, gosh, is this always going to be like that? Am I always going to be the only one? That has changed. So I did kind of get that wrong, and I'm very happy that that's changing.
That's awesome. Okay, thank you for sharing that. Dr. Lott, what is it that you got wrong about your field?
Well, what I would say, it's not the field, my specific field. It's more about the field of medicine, and it's really just the bureaucracy. You know, what I do is great. I love what I do. I love my patient interactions. I love all of that. The part that just grinds on you is the paperwork, and I didn't realize be so much paperwork. You know, it's gone from the days where, you know, as a physician, you say what you need to do, you write a couple of things on the paper, it gets done, that's where you stop. You know, now, you know, you have these insurance companies that will say, well, I don't agree with your plan. You should order this test instead of this one.
That's usually cheaper.
Like, no, it's not.
Right.
But that's the stuff that I've got to deal with now. And that's the part that just kind of rankles, because I'm like, I've been doing this for a little bit of time. I have a real good idea of what can work and what doesn't work. And you may want to do it this way, but that doesn't mean it's the best way. And it's not necessarily in the best interest of my patient. But go off.
How do you is that like a major encroachment in your practice, you think? Like the effects of insurance, the bureaucracy, the constant, having to document everything, does that affect you?
It does, to a degree. So one of the things that I've learned to try and help with that is sometimes, maybe once every year or two, I may actually pull for the things that I deal with most frequently. I may pull the actual insurer's guidelines of their medical necessity requirements, and then I update my phrase so that it includes what they require to justify what I feel is necessary. And then I put that in my note so that when they decide that they want to do a prior authorization and they want me to call and talk to them, I will answer and say, have you read my note requesting this particular procedure? And if you have, why are you calling me? Because your insurance recommendations and guidelines are listed in my dictation. So if you read what I wrote, then you shouldn't have to call me to get an authorization for why I want to do XYZ. So that's one of the ways that I kind of get back at it to try and streamline the process. Otherwise, I'll have to do PAs for things like CT scans for people that need lung cancer screening, or sleep studies for people that have sleep apnea and need to be on therapy. So I do those things to kind of fight against the machine just a little bit. Makes me feel a little better when I give them that call and I can tell them to read my note, and then they give me well, yeah, you're right, everything's where it needs to be, and then they give me the approval. And
Okay. All right. Well, thank you for sharing that. So, folks, once again, he's saying that the biggest issue for him is the level of bureaucracy, the red tape, the documentation, insurance companies. Dr. Brandon, what about you? What'd you get wrong about going into your field?
I remember so I did my fellowship at Baylor, at Baylor University out in Waco, which I have big love for Waco. I miss that place. But I remember going through fellowship and seeing the interaction between the head coaches and like the admin and my attendings. And I used to always see that. And I used to always say, okay, it's not too bad, right? Like it'll be fine once I get to get to the position. And I don't think I realized how difficult it would be to have a head coach breathing down your neck about wanting a player to be available to play. Because what they don't talk about, right, is the fact that it's money involved, right? When you're at the Division I level, a head coach's salary, right, is involved, right? Because if team doesn't win, coach doesn't win, coach loses job, right? So if coach feels like said player needs to be there, but is unavailable because of what I have recommended or because of what I said, coach then approaches me and says, "Hey doc, what's going on?" And so now I have to get pulled into the offices of conversations about the reason why I said this player cannot play, right? And like one of the big examples I have was I had this kid who had mono. And and so again, when it comes to contact sports, you're done for 3 to 4 weeks. And sometimes, you kind of err on the side of the 4-week margin, right? Well, he's also got an enlarged spleen, right? His white count is still up, his liver enzymes are up. And so when I'm telling the head coach, I'm like he's doing
So basically,
and
if he gets hit, he can rupture his spleen.
that's it, right? And even
Okay.
in the meeting, I had to tell the head coach, I'm like, you're what the part that you're missing is the fact that you play a contact sport. If he was to go out there with this enlarged spleen and take a small elbow to that part, that could be it right there and then. And I'm like, I know it seems extreme, but I have to be extreme to get you to understand the reason why I'm saying no activity. And it's happened multiple times where I have to have these conversations about why an athlete cannot go back in the game. And sometimes it's just like, you got to be kidding me. Like, where am I missing you at here? So that's the part I think it was just like, so yeah. I just wish I would have known more of that. And not like you can do anything about it, but hey, it is what it is. Put your big boy pants on.
Yeah, it's a high pressure situation, I can imagine. I think if I was to give my opinion on what I got wrong about my field, I definitely think that what I got wrong about my field was that there wasn't any room, or there wouldn't be any room to do kind of things outside of the box. And I always thought that there was just only one way. If you can kind of look at it as a block, you're trying to put a square, shape through like a circle peg, like it's just never going to work.
Right.
And I realized that like you really have to force your way to kind of live your life the way how you want to live, or live your practice, or do your practice the way how you want to do your practice. And I think that if I didn't realize that early on, I would have been down a path of either divorce or being estranged from my kids. So I always kind of thought that, well, just part of being a surgeon is having a really bad personality, being very acerbic with people,
Yeah.
having, to tell your spouse that, hey, like career comes first and then everything else comes afterwards, kind of like what Tom Brady's going through right now, right?
Right. Yep.
Right.
Prime
And
example.
I realized, and if anybody knows my wife, Dr. Renee, like she's not having any of that anyway, right? So she's not having any of that. And thank goodness, right? Because she kind of saved my personal life, so to speak. So I think one of the things that I got wrong that I was able to kind of turn around is that, listen, like there's room for everybody and everything in the world of medicine. You just got to have the guts. You just got to have the dedication. And ultimately, you have to be able to sacrifice something to get the lifestyle, to get the career that you want. There's room for everybody and everything there. So,
And,
but this is not
and
about me. Go ahead, Dr. Brandon.
well, what I was going to say, because I think you said something, I think you said a couple different things in there that I think is really important to say, because I think it's something that as you continue to practice medicine, dentistry, pharmacology, whatever it is, as you continue to go along, you start to learn how to play the game and make the game work for you, right? And there may be those sacrifices that you have to do early on, but you start to, as you continue to go along, you start to recognize and pay attention, like, okay, I can play the game this way and I can get everything done and be just as good, if not even more outstanding, but still have room and time and space in my life for said things. And I hope a lot of people really understand that, like, yes, early on, yes, you're going to have to sacrifice and you're going to have to play their game to a certain degree in order to you get to a certain point. And I remember Dr. Landry, he and I had this conversation about a couple of years ago about all the different things that I wanted to do, but I was in residency. And he was like, you got to understand, it's not your time to do some of those things. Right now, that's your time that you have to sacrifice and make these things happen. Once you're done with all that, then you can start making your own way, right? And so I just thought that you brought up a great point, because I think now in my career, I tell people all the time, I'm gonna do what it is that I want to do, and I'm gonna work hard, and I'm gonna grind, and I'm gonna make sure that my business is taken care of. But at the same time, I'm gonna make sure that I do what it is that I need to do for myself, for Tyler, and that's why I coach and do everything else. So I just thought it was a great point that you brought up.
Well, since you brought up, let me throw the ball back into your court. So what are you doing outside of just seeing patients? Talk to us about the play hard aspect of your life also.
Yeah, one thing I have found an extreme love for is I coach two of my daughter's teams. And I have, like, I mean, like, genuinely, I'm at the softball fields probably 5 days a week. But I absolutely love it. And it feels so good to be out there coaching her, coaching some of the other girls, building her village, building our softball village. But I do, like, I love being out there. Now, of course, I golf when I can. Nothing but watch sports all the time that I can. I have some other things that you enjoy doing, as far as tasting of fine beverages, um, but and the other thing I'll say that I have learned to I've enjoyed traveling, and because I've got to travel with USA Water Polo, I've got to go to Europe multiple times, and that ends up being part of a leisure trip just because of the way time works out. So I've told people, like, if I have to leave early to get to practice, then I'm going to leave early to get to practice, because I have to get my daughter there. That's my time with her, and that's our thing. So if I got to leave early, okay, I'll see you guys tomorrow. Great thing about sports medicine is it's not life or death, and they will be okay. I promise.
Do you ever feel the pressure, like, okay, like I have to, like, what are they going to think about me if even as a male, I'm going to, I'm not going to spend time at work. I'm going to go spend time with my family, my daughters. Do you ever get that pressure to be like, no, you need to be at work?
I
Excuse me.
I think I did a lot initially, and I think I really let it kind of dictate and control how I moved. But like you were saying, when you listen to those who love you and care about you, they'll kind of say, hey, hello, wake up, right? And I'll be first to admit, like, I had some life things happen, and I'll say that my going through a divorce really taught me that I had to move differently. That taught me that I needed to make sure that I make time for my family and make sure that I make time for Tyler. And so really that was a big thing. And honestly, that the pandemic, the shutting down of life in general, really taught me that I had to take a step back. And I learned that I didn't have the best relationship with my daughter at that time. And that's because I was doing so much of everything else. And I just learned that I needed to make a priority. So now it's like, I could care less what you think. My baby girl needs daughter, and I don't want my daughter to grow up thinking that her dad wasn't here or having daddy issues. I don't want none of that. You know what I'm saying? I think about that all the time, but it's like, I just feel like she needs her father in her life. And so guess what? I'm gonna be here, and you can judge me however, but I tell you what, all my patients and all the athletes and everybody here at CBU will tell you how outstanding of a doctor I am, as well as being an outstanding father.
Dope, dope. Dr. Liz, what about you? What are you doing outside of seeing patients?
I'm a beach person. I love the beach. So I thought I wanted to buy a house by the beach until I realized how much they cost. So So I did the next best thing recently, and I bought a house by a lake.
Nice.
And a year ago tomorrow, so last Veterans Day, I became a boater. So I bought a boat, and I love it. And I just love being outside. I've always loved being outside. I like to garden a lot, and I do like to travel. So, but recently it's been a lot of just pontooning.
That's awesome.
Okay. Okay. I like it. I like. Dr. Nathan, what about you? What do you like to do outside of seeing patients?
I
Driving that
love
Tesla?
I love spending with my son.
Hmm.
I mean, he is my shadow. When I'm not at work and we're together, it is he's underfoot. Like, it's one of the rare that he's not sitting right next to me.
Yes.
But
Yeah.
it's that, and I just love, I love spending time with family and doing things with family. It's important to me. It's something that I really, really enjoy. So, my work is what I do, but even in my job, my coworkers know when I say, "Hey, I'm about to take off to do this," if they need to provide coverage, we'll provide coverage. My boss is very big on family and work-life balance, and that means a lot.
Love it. I love these answers. These are amazing answers. Let's do our last question before we round out the night. Folks, Dr. Nathan, let's start back with you. What's your most memorable patient experience?
Man, I have many of them. I'll just go with the most recent one that I had. Since I've moved, I've been here in Waco about 3 years, and I had a patient that I ended up diagnosing with lung cancer, fairly early stage. So we got her for surgery, resection, yada, yada, yada. And then late had metastasis. And,
What is what does that mean? Tell folks what that means.
means the cancer was no longer confined to where it was initially. So she had probably had a small focus of cancer cells that had left where the original tumor was that just wasn't present when we did her initial workup. And over the last 2 years, I've been following her. We see her in the office, and then about a month ago she came into the office just feeling weird, telling me she was a little unsteady on her feet, and that's when I knew the cancer had spread to her brain. So I sent her emergently for everything that she needed to have done. She ended up having brain surgery. I saw her this week, and we completed our patient care loop. I put her on hospice, and I say it's a good thing because she was very thankful for all of the care that I provided. And, I gave her a hug, and I just told her, hey, if there's anything I can do, please let me know. But it's rewarding because she felt comfortable enough to come back and see me through all of this. And it's those patient interactions that really help me to get through even times like this where I know that they're going to die, but at least I know that they appreciated the care that I provided, and I feel like I gave them the best care possible.
Thank you for sharing that. I love that. Dr. Liz, what about you? Do you remember? Did you have a very memorable patient experience?
I have so many, particularly with the veterans that have experienced homelessness. They teach me a lot. But there's one particular veteran who wasn't a homeless veteran that I'm recalling right now. Very impactful for me because he was a helicopter pilot in Vietnam. So he would tell me the stories about how at dust off, he's taken off with injured soldiers. He was a medevac pilot and getting shot at as he's trying to fly away, and all the missions that he took. So this was my patient, and he came for an exam one day, and I noticed he had this dark pigmented lesion on his cheek, and he's like, oh, no, it's been there. And I'm like, I don't know about that. And he really wanted to just pretend like it was nothing, but I put my nagging mom hat on and I kind of followed him outside, and I said, no, I wasn't kidding. Like, I really need you to go get this taken care of and looked at today. So anyway, he came back, and I wasn't sure what he was going to do or not do. But he told me, it was a melanoma, and that his physician said that had he not caught it when he went, he would have lost his eye. And why it's memorable to me is that he gave me his wings from his that he wore on his uniform, all those on those missions. And so I have those wings.
Oh, wow.
They're very, it's very special to me, that he departed with that and gave it to me. So that's
a very special story.
Yeah.
Dr. Brandon, what about you? What's your most memorable patient experience?
I don't know if it's a patient experience. I'll say it's a team experience, I'll say. So covering women's basketball here at CBU, during the pandemic, when they were trying to keep athletes playing and we're having to test 3-4 times a week, and it's just a whole big mess. During the me and our athletic trainer, we were able to keep our girls healthy through that entire season. I think we had one small outbreak where 3 girls got sick. Outside of that, nobody had gotten sick. Our girls went undefeated through the regular season, and then they went on and won our conference tournament. And it was the first time that they'd ever played in the conference tournament. And then we went on to the NIT and made it to the Elite Eight. But it was an amazing experience to be able to travel and to be able to keep them healthy and safe during this pandemic, and realizing how important how important a part of the team you are. So what they did, I'm gonna see if I can show you. They gave me a championship ring.
Wow, nice. That's a lot of bling.
Yeah.
And so that was having them acknowledge, and they all gathered around and presented me with the ring and just said, thank you for keeping us healthy. Thank you for keeping us safe during this pandemic. It was truly it was an awesome feeling. And it's that team, that 2020 women's basketball team is always going to be part of my journey, because that was a ridiculous time, and they were a dope team. So
yeah, I can imagine dedication and success in a very under duress, basically, so to speak.
Absolutely.
Yeah.
Yep.
So I'm not going to share my story because it's going to take too long, and we only got 2 minutes left. But my stories are usually let's just leave it. Let's just keep it G-rated. My stories are usually things that people get stuck some places and stuff. But for the most part, my stories are related to people who may be on the brink of death, and we've gotten an opportunity to bring them back, or we've gotten an opportunity to maybe help them transition, like the way how Dr. Lott has said, in a very respectful fashion, where family can spend their last minutes or even days or even months with a family member in a very respectful manner. So that's kind of the experiences that I have. But Dr. Elizabeth Nunez, Dr. Nathan Lott, Dr. Brandon Henry, I want to say thank you very much for being a part of this Careers in Healthcare workshop presentation, because I think it's really important, that we share and show the different faces, as well as the different types of ways in which we all practice, and not just show just one type of thing and you guys have to do this, and if you can't do it, then you don't belong anywhere in healthcare or in medicine. Right. So this was a really great opportunity. So for the folks who are watching this, once again, Tour for Diversity, we are a grassroots effort to educate, advise, and inspire future minority health professionals with terminal degrees. As you can see by Dr. Nunez, the shirt that she's sharing. This was a great experience. You can follow us on Instagram at Tour4 Diversity on Instagram. On Twitter, if it still exists, we'll see in several months if Twitter still exists. At Tour4 Diversity. And then you can also watch some of our videos on YouTube. You can even see some of us, man, from 10 years back, guys.
Yeah.
Even 10 years, I still didn't have hair 10 years back then. So on YouTube, just check us out and you can subscribe to us there. This was a great opportunity. I hope you guys are inspired. I hope you guys continue to follow us and reach out to all of us. We're all available to answer any questions that you may have, or even just inspire you if you need it. So, to the panelists, thank you so much for coming on.